Indiana's HIV crisis has renewed concerns about another potentially deadly infection, this time hepatitis C.
Yeah, the CDC says 3 million Americans have it, including 5,000 Hoosiers.
But an IT-made investigation found some patients are being denied access to drugs they're told could cure them. IT-mate's
Bennett Haeberle is here to explain why. Bennett.
Brooke, some of Indiana's poorest patients are being told they must wait until they get sicker before they can have these drugs. Experts believe the high price, $1,000 a pill, could be why some states are cracking down on who gets cured.
It's definitely the devil. It's a bad drug. So.
For Brent Wright, the devil was Opana. His battle with pain pills ended 8 months ago.
Oh yeah, I'm clean now.
Clean, but fighting a new demon. Brent contracted hepatitis C, he believes, through sharing needles.
Definitely scary and definitely to put things in check.
Hepatitis C can attack the liver. Fearing he might spread it, Brent went to Dr. Huey Wen, who wrote him a prescription for Sovaldi, a drug known for its high cure rate and its high price tag.
It's around a $50,000 treatment for 12 weeks.
Similar treatments can run even higher, sometimes $80,000 to $100,000. But instead of the drug, Brent got this letter from his insurer telling him they were unable to approve him because he wasn't sick enough.
I'm not understanding. It seems like something's broken. It needs to be fixed somewhere.
This right here is liver scarring. That's the stage that state Medicaid requires that hepatitis C patients have before they can get access to the drugs they need. Dr. Huey Wen says up to half his Medicaid patients are rejected the first time they seek the drugs, meaning Brent is not alone. State figures show Indiana Medicaid patients so far this year have been denied 68% of the time. So we're talking about hundreds of patients.
That's correct.
Acquiring the medications, Wen says, takes months and often requires his staff to help patients sort through the red tape.
Honestly, I think it would probably be close to about 10 hours.
10 hours per patient?
Yes.
Is that a good use of your time?
No. A pinch, okay.
Nurse Kayla Kilburn says her time on the phone dealing with prior authorization requests from insurers takes time away from patients.
I just think it's very frustrating. You know, I mean, people that are employed, have insurance, and they can't get the medication that they need.
The reason may boil down to policy. Indiana's Medicaid program has committees like this one that approve restrictions on certain drugs. Criteria are spelled out detailing what symptoms patients must have before they can start the medications. One policymaker told IT-Mate, "We use national treatment guidelines to apply evidence-based medicine to the criteria." But experts worry the high cost of the hepatitis C drugs might be why some patients are being denied. Do you feel like cost is part of this equation? I mean, the reason why these restrictions are in?
I think so, because I think the state health system has to look at their budget year by year.
No one here at the state's Medicaid office would agree to discuss this on camera, nor would any of the members of the Drug Utilization Review Board, the people who decide what restrictions are in place. The chairperson told me that costs are not a factor in their decision-making process. But two other members told me that it is at least a consideration. Indiana isn't alone. At least 30 states have similar restrictions, requiring both signs of liver scarring and a specialty doctor to approve the treatment. Do you think the state is doing the right thing?
I think that they're in a difficult position because if you treat everyone with Hep C immediately, everybody will be bankrupt.
The drug maker Gilead would not agree to an on-camera interview, but did release a statement to IT-Mate saying the price of Sovaldi and Harvoni reflects the innovation of the medicines and that they offer a cure. In the past 6 months, Gilead's revenue has topped $8.2 billion.
It's because the pharmaceutical companies are overpricing this medication, and that needs to be changed.
Brent's mother, Jackie Johnson, has now taken over her son's fight while he's in rehab. She drove to Indianapolis recently from Scottsburg to appeal her son's denial before his managed care provider.
You can just leave that there.
Our cameras weren't allowed in, but Jackie left in tears.
The guidelines are unfair for everyone throughout the United States. You can give pregnant women opiates, but you can't give these people their medicine that are sick. What kind of law is this?
What was your takeaway?
I knew the answer was going to be no from the get-go.
It may not have ended the way she planned, but Jackie says her fight isn't over.
Whether I win or lose, at least I can say I tried.
2 months after being prescribed. Brent still hasn't received any medication. And while Sovaldi isn't the most requested drug among Indiana Medicaid patients, it is the most expensive. Indiana spent more than $11 million on it last year. Financial assistance programs have been offered through the drug maker, but those too are now restricting who can take part. Bennett, Haeberle, 24 Hour News 8.